Welcome back. Millions of people suffer from joint pain every single day, but you don't have to live with the pain forever. That is great news. And Dr. Alan Hibberd, he's an orthopedic surgeon with San Antonio Orthopaedic Group, and he's here this morning to tell us more. Good morning.
Good morning. How are you?
I'm doing well. You know, not a lot of people can say the same if they're dealing with joint pain. Is this a common reason why people are going to see you?
Oh, of course. Matter of fact, arthritic type of complaints are one of the most common ailments. Matter of fact, majority of disabilities in this country are caused by that. So, and actually, almost everybody will have it. It started, if you look back in the mummies and ancient peoples, everybody had arthritis. Unfortunately, we don't have a cure, but we have treatment.
Right.
And if you live long enough, you're going to have it. You rarely see someone in their 80s or 90s that don't have it. And it's very timely for us to discuss this because one in five people will have it or get it. Wow.
So what joints are you seeing it in the most?
Well, we're going to talk just mainly about osteoarthritis, which is degenerative arthritis. Usually it involves the weight-bearing joints, mainly the knees, then secondarily probably your hips and then your ankles.
And that's what I hear a lot of when people are complaining about joint pain. It's typically, you know, knees and hips, the joints you were mentioning. Now, there's these injections.
Yes.
What are those?
Well, there's a lot of ways to manage it. One of the reasons people get it is because they do a lot of weight bearing. And the way your joint is made, there's a special cartilage overlying it. And it's really a wonderful structure. It works like memory foam, but it does it so rapidly that every time you take a step, it kind of squeezes. Within an instant, it's back. The problem with that is that particular type of cartilage is very slow to heal. And if you get an injury to it from a sporting injury or just wear and tear, then it heals slowly, and when it heals, it doesn't heal with the same type of cartilage. It heals more with a kind of a scar tissue, which doesn't work near as well. Now, the reason people have pain from arthritis is usually because they get inflammation. Your body responds to the fact that the cartilage isn't working very well. It makes you have a lot of extra fluid, and you got a lot of inflammation, and that's what hurts you. So usually when we start off in treatment, we usually start off with something simple. We try and do the least risk to you, the least expensive. We start off with things like Tylenol, and if that doesn't work, we'll go to some type of anti-inflammatory drug like Motrin or Aleve, Celebrex, those type of agents. And if we get to that, and of course, weight is a problem, lifestyle is a problem. If you're starting to get arthritis, jogging is probably not the best for you. You may want to get into bicycle riding or swimming or something else. But once we try all those things and they're not working, then we go to injections. And there's really two types of injections, steroid injections or hyaluronic acid injections. You may have heard like Synvisc, Euflexa, those type of medications. And each work a little differently.
And the injections, is there downtime after you're receiving an injection, or is it pretty instant? How quickly do they work?
No, I wouldn't say. The cortisone injections basically is an anti-inflammatory drug. It does what the Motrin and the other agents will do, but it's local. You put it right in the joint, and it works really, really quite well. Sometimes it'll be a little sore for a couple of days, but then it works over a couple of weeks. And the way that works is the lining of your joint gets very inflamed. And if you look at it like we look at arthroscopically or when you do a joint replacement surgery, it's red, it's thick, it's inflamed, and that kind of mutes that down and mutes basically the immune response to the poor cartilage. So it works very good. Now the problem is very often it'll work very good the first time, but as the disease process worsens and worsens, after a while it's not quite as effective.
Yeah. Dr. Hibberd, thank you so much for all the information. If people are experiencing joint pain, if something he said related to you and you think, I need to go visit them, you definitely can. Give them a phone call, 210-804-5400. You can visit them online, TSAOG.com. They are also on Facebook and Twitter, so you can definitely find more information there. All right. Thank you, Dr. Hibberd, for joining us this morning. We have so